Doctor, does thyroid hormone affect infertility and pregnancy?
Thyroid hormone disturbance is very common in women than in men, and it constitutes between 3 to 10 people out of every 100 women. That means the incidence of that problem is around 3 to 10%. In the area of reproductive medicine, one of the common hormones we check is the thyroid hormone, the prolactin hormone, and in the ovarian reserves we check the AMH hormone. Here I will be talking about the role of thyroid hormone. Thyroid hormone can be excessive, in which it is called hyperthyroidism. If it is deficient, it is called hypothyroidism. If a woman has hypothyroidism, it affects the menstrual cycle and also affects the ovulation, which in turn affects the fertility. That means if a woman has a thyroid disturbance, in particular a deficiency of thyroid hormone, then her egg release function or ovarian release function, also known as ovulation, is disturbed, and in the process she can get a delay in conception. The other impacts of this thyroid hormone is, if we don't diagnose a thyroid problem and if it is in the borderline levels, it also affects the neurological development of the baby. So in the last decade, there is a lot of importance of doing a thyroid hormone testing. The common test that is done to assess the thyroid is also known as TSH or thyroid stimulating hormone. The accuracy of these tests depends on the type of diagnostic technology used. Essentially, there are 3 generations of technology: the first generation, the second generation, and the third generation. The second generation test has an accuracy of 0.1 milliunits per liter, where the third generation has an accuracy of 0.01 milliunits per liter. At KrishnaIVF, we use the Vidas technology, which has an accuracy of about 0.01 milliunits per liter. So that Vidas diagnosis of a thyroid is very accurate. Once you have a diagnosis of thyroid dysfunction, then either your reproductive medicine person or your gynecologist or your physician or endocrinologist will ask you to take a tablet called thyroxine, and the dose is determined by your weight and the amount of thyroid deficiency that is there. The most important thing when you are taking a thyroid tablet is you should take it in the morning and avoid taking thyroid tablet along with iron tablets or calcium tablets, as it affects the absorption. Once you have started taking thyroid tablet, at the end of 6 to 8 weeks, you should check whether the amount of drug that is given to replace your hormones is adequate by checking the TSH hormone, also known as thyroid stimulating hormone, and free T4 levels are also checked to accurately adjust the dosage. Once your levels become normal, lot of people mistake that they can stop the thyroid tablet, but the answer is no. They have been corrected adequately and they should continuously use it and see the physician once in 6 months for evaluation of the thyroid. In pregnant women, if there are already thyroid disturbance is there and they are taking the tablets, in the first 3 months they should have a checkup of the thyroid hormone and a dose adjustment is needed, and every 3 months, that is every 12 weeks throughout the pregnancy, they should have assessment of the thyroid, because it can impact the reproductive performance or the performance of the pregnancy, and in turn the development of the baby might be affected. So even though thyroid looks very common, it's a very sensitive hormone, a very important hormone, and one should use it regularly and have it monitored regularly so that you get the full benefit of the treatment. Unlike deficiency of hormone, the hypothyroid, excess thyroid generally does not affect infertility but affects the pregnancy. So the management of excess thyroid hormone is to reduce that hormone by tablets and continuously monitoring it. In conclusion, thyroid is a common test that is done to pick up the problem because out of every 100 women, 3 to 10 women will have this problem. It can be diagnosed easily by the TSH estimation, and it can be corrected easily by taking the thyroxine tablet, and the dose is adjusted based on your deficiency and your weight, and you should continuously use it to get the maximum benefit of that particular hormone.